My name is Maria Okoli. I work for Global Women's Health Right and Empowerment Initiative, a sex worker-led organization in Nigeria. We work for marginalized and minority groups of women and children. And we've been in existence since 2014 and I work closely with a lot of partners, ranging from Center for Clinical Care and Clinical Research, CRN, AP Public Health Initiative, Heartland Alliance, and many more. And we've been working to impact in the lives of sex workers, both on their sexual and reproductive health, and addressing issues around gender-based violence, reaching out to our marginalized community on information around HIV and AIDS, enrolling positive clients into care at the CCRN, OSS, and DICs. They have made services very convenient for clients. Clients could access treatment at a very convenient time, and also pick up drugs at a very convenient time. They've been able to walk through that plan. That has made a lot of sex workers turn up for their job pickups and also attain viral load, despite the fact that there would also be community challenges, knowing very well the type of population we program for. They're very mobile. So CTRI has closely worked, their clinic team has closely worked with Gweri to develop plans that could also help sex workers fit in other activities they would like to do and their mobility. And that has been like a big one for us, because over time on the project, we have realized that our clients who has attained viral load are also super excited, and of course we'll have them on board to have this conversation.
I was enrolled as a reactive client in this OSS. I think it's about 4 or 5 years ago. I got to know of my tier 2 for like a year plus before I got enrolled because of fear of stigmatization. So I spoke to one of their staff who really encouraged me that there would be no problem. She brought me in and she made sure I was enrolled. And since then, it has been wonderful.
Doreen Ikpe, the program manager of Gweri, asserted that the project has been of great significance to Gweri and the marginalized and minority groups.
Those who are raped, we ensure they get uptake of PEP. So, and some of our implementation strategies that APIN have really helped us is the case of moonlight testing. APIN give us enough support, both financially, technically, and otherwise, to ensure that our moonlight testing goes well. And 2 months back, we got people from Abuja that came to see what we do at the field level, how we carry out our moonlight testing. And that day, we learned something new, that a day, if the work is done well, you'll be able to get like 3 positive or more, and we'll enroll them to care. And we're able to get 3 positive, that's nice, and they have been enrolled to care.
I am Becky Manga, the gender focal person for Global Women's Health Right and Empowerment Initiative. Under the ICARES project, Global Women is implementing in Logo and Makurdi. And we've been documenting incidents of gender-based violence. We've been assisting survivors with psychosocial support. We do referral for clinical services to APIN OSS. We also do referral to other stakeholders in the state that we work with. We do referral for survivors to see psychologists. We do referrals for clinical care. Depends on the kind of violence. Some cases end up in court, some don't. The ones that end up in court, it's been on and on. We're still hoping that we will stand one day and say, yes, we got justice. So many people on this project we've assisted. We have a lot of survivors, some of them not willing to come speak out, but some of them willing to. They will share their stories themselves. We are excited. This project has come a long way. We want to say thank you to EPIN for the opportunity to serve in our community. We are grateful.
Global Women interfered in my case. They helped me a lot from the police station now till the case is in court. They help with the medications and everything. And now I feel better than before.
I am the mother of the 16-year-old girl who was raped by a close neighbor of ours. The person that she called uncle. I look up to him as if he's my brother. We are very close, but he raped my daughter. But thank God for the global women that came in. If not for them, they wanted to take the matter as if it's not even a matter. But I thank God that when the global women came in, with their help and the help of God, I thank God on how they are taking up the matter. And I pray that God should be by their side and God should help them and reward them, because I don't have anything, we don't have anything to give them, but we just pray that God himself should reward them for us.
In line with EPIN's aim of achieving a disease-free world, the marginalized and the minority groups were provided with health care services.
My name is Sunday Oluohu. I am the medical laboratory scientist in charge of this facility to take care of the laboratory program in the KP program. I have been employed to work for this organization within the last 3 years, and I have primarily been in charge of all the CBOs whose clients are enrolled with us, and I am the viral load champion, as well as coordinating all the retesting activities to confirm a client before they are enrolled into care. We also manage PrEP enrollment and STI testing, and we also coordinate other testing activities as regards HIV program. For the period of time I have been here, we have had a very pleasant relationship with GWERI as a CBO, and the viral load sample collection rate has been very optimal. I think within this period of time, we have never gone below 90% of viral load coverage, and that's a very good one. Within the last quarter, we've had over 96% viral load collection, and then we've had up to about 98 viral suppression from this client from GWERI, and that's a very good one. And the ones that fell below that, which is LLV, low-level viremia, have been perfectly tracked back into care, and adherence counselor interfaced, and she has done a perfect job there. And we're hoping to see within the next quarter viral load to see the outcome of these results.